I'm Carrie with In Motion OC Physical Therapy in Irvine, here to talk to you about a common injury, shin splints. So shin splints is common in people that run and do a lot of jumping activities such as basketball. What it is, it's an overuse injury of two different muscles in your shin. So one's the tibialis anterior, which goes around right here, and tibialis posterior, which is more back here. So what happens is this muscle gets a little bit inflamed, and it causes edema and irritation, and it causes pain when you're doing these activities. So what we have is a couple exercises and stretches that you can do to help with this injury. This program is a general program, so it doesn't take into consideration your individual differences. So make sure that if this program is not making you better and that your pain's not going away, then we recommend that you stop what you're doing and go seek further evaluation. So here are the exercises that we have. Okay, so this exercise works on the muscles around your ankle. Okay, so it's called toe walking and heel walking. So you're going to do exactly like it sounds. You're going to walk on your heels, keeping your toes up in the air. Okay, for these ones, you want to try and keep your knees straight, but you don't want to keep them super bent, but not locked out either. Okay, so nice and relaxed. Okay, so walk like this. Try and do a couple laps. So do maybe like a minute of each. And then after you do this, you're going to go up on your tippy toes as high as you can, and then walk on your tippy toes. Once again, do it for about a minute. And once again, this is called toe walking and heel walk. So this exercise we're going to do is it's called the calf stretch. So the calf is made up of two muscles, the gastroc and the soleus. So the first one for the gastroc, you can use a step or a stair, anything that you might have at home. But you want to be able to have your heel come off the end, okay? So the key for this exercise is you want your knees straight and you want your toes in front of your heels. So when you do this, you should feel it more in the gastroc, and that's this area right up here, okay? So when you're doing this, hold it for 30 seconds to a minute. Make sure you get a good nice stretch. After that, to work more of the soleus, you want to bend your knee. Same thing, toes in front of your heels. This one you should feel a little bit lower. So it should be back here, okay? So the key for these stretches is you want to be able to hold it for 30 seconds to a minute, and you want to be able to feel it where you're supposed to without any pain. So once again, these are called the calf stretch. So the next one we're going to do is a single leg balance, okay? This one's a really good one to do around your house, say when you're washing the dishes or when you're brushing your teeth. It's literally you're just standing on one foot, okay? The keys for this one though, you want your knee not super locked out, but you want it just bent a little bit, okay? It makes it a little bit more stable. Steer straight ahead, and you don't want your hips super down, you don't want them up, you want them nice and level, okay? So for when you're trying to balance, try and hold it for 30 seconds to a minute on each foot. So once again, this is called the single leg balance. Okay, so this next exercise we're going to do is called windshield wipers. So what this does is work on some of the muscles in your feet. So for this one, you're going to sit up nice and tall. You're going to have your knees even with your hips. So you don't want them to come in, you don't want them to come out. Your knees are going to stay stationary. So a good way to make that happen is you can put your hands in between. Okay, and the point of this one is you're going to move your feet in and out. Okay, the goal is to not just move your feet like this. You want it nice and controlled so your muscles are working correctly. So actually your arches should increase a little bit, and then they should go lower, okay, as you go back and forth. So when you do this one, do it 10 times, and you're going to do it 10 repetitions and 2 times each time, okay? And these are called the windshield wipers. So some key points about the exercises we just went over. Make sure that you have good foot support. So you want good arch support and cushion on the bottom of your shoes. That also can contribute to this injury, so that's very important. Make sure that you decrease the amount of running and jumping you do on hard surfaces. So think more dirt versus concrete. Make sure you warm up and you stretch before doing any kind of physical activity. And last but not least, if you feel any pain when you're doing these exercises, stop what you're doing and go seek further evaluation. If you're interested in physical therapy, it is covered through insurances, and we are more than welcome or more than willing to help you out. If you can go to our website at inmotionoc.com.